Let's go.
So we're here at Kibayoni Dispensary on doing our data supervisions, and one of the things we wanted to explain is how using data can actually uncover some of the challenges that are facing the health center. So before we came to this health center, we reviewed some of the data that they have, and we looked at their vaccine data. So vaccines, they fill out a form every month to say how many vaccines they administer, and then talk about the stock of vaccines that they have in their facility. And throughout most of the year, they were administering vaccines to children and writing down all the data. But around October, they started having no data that showed up at all. So we were confused. We asked folks in the district, and they didn't know why. So when we came here, we talked to them and asked what the problem was. And as it turns out, is that there's actually these are the refrigerators that keep the vaccines cold so that they can actually be administered. And the vaccines, the refrigerator is run by a gas unit, so they have actually been out of gas since October. And so when they're out of gas, they can't keep the vaccines cool. So we work on three different ways to fix the problem. Number one, the people in the district, when they see this data that's odd, where there's these changes in data, they need to be proactive and reach out to the people that are here. You know, maybe they're not going to be able to actually come out and visit them, drive out here because it's pretty far, but they could pick up the phone and they can call them and ask what the problem is. The second thing that we're trying to advise is that people that are actually here in the facilities, when they're filling out their data forms, they know what's going on. They know that they're out of gas. So they need to try to reach out to the people in the district. And again, whether that's a phone call, that's one thing, but the very least, the very basic thing that we want them to do is actually write in on the form, maybe right on the back of the form or write in some blank space, we're out of gas, like we need more gas, be very explanatory when there is these sort of aberrations in the data. And then the third thing that we're trying to do is, you know, these units are used all over the country. It's the same units and they all run on gas. So one of the simple things that they could do is actually on the vaccine form, have a space where you can fill out, are you out of gas, are you running low on gas, so that they know in the district that they're actually able to come out and fill that gas. And so we've discovered a problem. The next step is actually fixing the problem, and there's a lot of different sort of challenges in the way of actually fixing the problem, getting the gas out here, considering that we drove out here and it was 3.5 hours to get here and a lot of gas. So it's not as simple as just transporting the gas here. But the big point is that using the data, we uncovered a problem that can actually be fixed now, and we're trying to sort of set that as the standard operation.